The trauma bay floor was slick with blood. Monitor alarms screamed through the room. A nurse was being dragged toward the door by military police, and the chief of trauma surgery was pointing a bloody scalpel at her like a weapon. "Get her out of my hospital!" Dr. Charlie Caldwell shouted. The woman didn't fight back, didn't panic, didn't even blink. She just stood there in wrinkled navy scrubs, breathing hard, one hand stained red to the wrist. On the operating table behind her, a Navy SEAL commander was dying, and according to the most powerful surgeon in San Diego Memorial Hospital, it was her fault. "You assaulted an attending physician," Caldwell barked. "You performed an unauthorized procedure. You put this patient at risk." The MPs grabbed for her wrists. Steel handcuffs clinked in the fluorescent light. Then suddenly, one of the heart monitors changed tone. Beep, beep, beep. Slow, strong, steady. The room froze, because 30 seconds earlier that same monitor had been screaming flat chaos while the SEAL commander crashed toward cardiac arrest. Now his pulse was stabilizing. His blood pressure was climbing. And the only reason he was still alive was the quiet nurse Caldwell wanted arrested. Rain hammered the hospital windows. Somewhere overhead, helicopter rotors still thundered against the night sky. The entire ER smelled like antiseptic seawater, burned metal, and blood. Nobody moved. Nobody spoke. Then the wounded man on the table coughed. A wet, painful sound. His eyelids twitched open. Every person in the trauma bay leaned in at once. The SEAL commander's face was ghost white beneath the streaks of soot and blood. His chest rose unevenly under the oxygen mask. Tubes and IV lines hung from his body like wires from a damaged machine. His eyes drifted across the room slowly, past the armed MPs, past the terrified nurses, past Dr. Caldwell standing there furious and humiliated. And finally, they landed on the woman in handcuffs, the nurse, for the first time all night. Emotion crossed her face. Not fear, recognition. The commander stared at her like he'd seen a ghost. The room became impossibly quiet. Only the soft hiss of oxygen remained. Then with obvious pain, the wounded SEAL slowly lifted his trembling right hand. Nobody understood what he was doing, until his fingers reached his forehead. A perfect military salute, held directly toward the nurse. Several people in the room actually stopped breathing. Dr. Caldwell looked stunned. "What the hell?" one resident whispered. The commander's cracked lips moved under the mask. "Captain." His voice barely carried across the room, but every single person heard it. "Good to see you again, ma'am." The handcuffs slipped from the MP's fingers and hit the floor with a metallic crack. Nobody touched the nurse now. Nobody even seemed sure they were allowed to. Dr. Caldwell stared between the commander and the woman in disbelief. "Hey, this is insane," he snapped. "She's a nurse." But the expression on the SEAL commander's face said otherwise. It wasn't gratitude. It was respect. The kind forged somewhere violent, somewhere far away from civilian hospitals and polished operating rooms. The nurse finally stepped closer to the table. Calm. Controlled, like none of this surprised her. "Easy, Donovan," she said quietly. "Don't try to talk yet." The commander actually obeyed. That shook the room more than anything else, because men like him didn't obey people easily, especially not when they were half-conscious and bleeding out. One of the younger nurses stared at Harper in total confusion. 3 weeks. That woman had worked beside them for 3 weeks. Quiet, invisible, always keeping her head down while Caldwell humiliated her in front of the staff. Nobody knew anything about her. Not really. Nobody knew why she wore long sleeves under her scrubs even during California heat waves. Nobody knew why loud noises sometimes made her freeze for half a second. Nobody knew why she never talked about her past, or why her eyes looked older than the rest of her face. And nobody, not a single person in San Diego Memorial, had any idea why a wounded Navy SEAL commander had just called the shy night shift nurse. Captain." Outside the trauma bay, thunder rattled the hospital windows. Inside, Dr. Charlie Caldwell's empire had just started to crack. And before the night was over, everyone in that hospital would learn exactly who Harper Quinn really was. Nobody in Trauma Bay 1 moved for several seconds. Even the storm outside seemed quieter now. Commander Donovan still held the salute, and Harper Quinn stood there with blood on her hands and steel cuffs hanging open beside her, looking like she wanted the entire moment to disappear. Dr. Charlie Caldwell recovered first, because men like Caldwell always did. His ego simply refused to process humiliation. "This is ridiculous," he snapped, straightening his ruined scrub top. "I don't care if she was a Girl Scout troop leader. She assaulted me in my own trauma bay." Nobody answered him. Not the nurses, not the MPs, not even the SEALs. Lieutenant David Miller stepped forward through the crowd of armed operators, his boots leaving muddy prints across the white hospital tile. The man looked exhausted. Soot covered half his face. Blood soaked through the sleeve of his tactical jacket. But the second he looked at Harper, his entire posture changed. Rigid, respectful, almost protective. "Captain Quinn," he said carefully. "JSOC told us you disappeared." Harper exhaled once through her nose. "Retired," she corrected quietly. "You don't retire from that world," Miller replied. That line hung in the room. Heavy, real. One of the younger residents glanced between them nervously. "What the hell is JSOC?" he whispered. Brenda heard him. "A Joint Special Operations Command," she muttered back automatically. Then she froze, because suddenly the pieces weren't pieces anymore. They were answers. The calm under pressure. The battlefield tourniquet. The way Harper never startled during trauma alerts. The way she could read a crashing patient before the monitors even changed. And worst of all, the eyes. Brenda had seen combat veterans before. Harper had the same eyes, the kind that always seemed to be listening for something far away. Dr. Caldwell scoffed loudly. "Oh, wonderful," he sneered. "Now we're doing military cosplay in my ER." Lieutenant Miller turned slowly toward him, and for the first time all night, Caldwell looked uncertain. "You almost killed him," Miller said flatly. Caldwell puffed up immediately. "I am Chief of Trauma Surgery, and she saved his life. And that procedure was reckless." It was correct. Caldwell opened his mouth again, but another voice interrupted him. Cold, sharp, authoritative. "Dr. Caldwell." The entire room turned. An older Navy admiral had entered the trauma bay, flanked by hospital administrators and 2 armed security officers. Rainwater still dripped from the hem of his coat. His expression hardened the second he saw Harper, then softened. Just slightly." "Captain Quinn," the admiral said quietly. Harper nodded once. "Admiral Croft." Brenda looked like she might faint. Even Caldwell lost steam for a second, because admirals did not walk into civilian trauma bays at 2 in the morning unless something had gone catastrophically wrong. Croft's eyes moved to Commander Donovan, then to the blood-filled syringe still attached to the drainage line near his heart, then finally to Caldwell. "You attempted chest decompression?" the admiral asked. Caldwell folded his arms defensively. The patient presented with classic signs of thoracic trauma. He presented with cardiac tamponade. Caldwell's jaw tightened. Harper said nothing. She just quietly adjusted Donovan's IV line while everyone else argued around her. That detail didn't go unnoticed by Brenda, or Chloe, or any of the nurses, because even after everything, Harper's attention never left the patient. Not once. Admiral Croft stepped closer to the bed. "You recognize the tamponade immediately?" he asked Harper. She shrugged faintly, and the neck veins gave it away. Then after a pause, "And the heart sounds?" That answer sounded simple. Too simple, but Lieutenant Miller gave a quiet laugh beside the wall. "She diagnosed one in total darkness once," he said. The room looked at him. Miller leaned against the counter slowly, exhaustion finally creeping into his face. "Mortar strike outside Raqqa," he continued. "Generators got hit. We lost lights, imaging, comms, everything." Harper visibly stiffened. Miller noticed, but continued anyway. She opened a guy's chest using a flashlight taped to another soldier's forehead. Nobody spoke. The storm rattled the windows again. "She saved 6 operators that night," Miller said quietly. "One of them was me." Across the room, Harper's face hardened slightly, like she hated hearing the story told out loud. Brenda noticed something then. Harper's left sleeve had ridden up slightly while adjusting Donovan's IV. Scars. Not surgical scars. Not accidents. Jagged silver lines ran down her forearm like lightning frozen under skin. Burn trauma. Shrapnel. Old war wounds. Brenda suddenly understood why Harper wore long sleeves every day. Not to hide from others. To avoid questions. Caldwell saw the room slipping away from him, and men like him could never tolerate losing control. She's not licensed to practice here, he barked suddenly. I don't care what war stories you people dragged in with you. This is a hospital, not Fallujah. Harper finally looked at him directly, and something in her expression changed. Not anger, not fear. Fatigue. Deep bone-level fatigue. You're right, she said softly. That caught everyone off guard. I didn't come here to do surgery, Harper continued. I came here because I was tired of deciding who lived and who didn't. The room went still again. Even Caldwell hesitated. For the first time, people weren't looking at Harper like a mystery anymore. They were looking at someone carrying something unbearably heavy. Commander Donovan stirred weakly on the bed. His eyes found Harper again. You still hear them? He rasped. Harper froze. The question hit too personally. Too directly. Donovan immediately regretted asking. You don't have to answer that, he muttered painfully. But the silence already had. Brenda looked between them, confused. Hear who? Then Harper quietly reached over and adjusted Donovan's oxygen mask. Her voice dropped almost to a whisper. Focus on staying alive, Commander. But her eyes had gone somewhere else entirely. Somewhere dusty. Somewhere burning. Somewhere filled with screaming and rotor blades and incoming fire. And for the first time that night, Brenda realized Harper Quinn wasn't hiding from Dr. Caldwell. She was hiding from her own past. Then suddenly, the heart monitor changed rhythm again. Fast. Irregular. Harper's head snapped toward the screen instantly. The SEAL commander's blood pressure began dropping. The drainage tube near his heart darkened with fresh blood. Harper's expression changed immediately. Pure surgeon now. Focused. Deadly calm. He's bleeding again, she said. And when she looked up at the room, everybody instinctively waited for her next order. The monitor's sharp warning tone sliced through the trauma bay. Beep, 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 beep. Fast. Erratic. Dangerous. Commander Donovan's pulse was crashing again. Fresh blood snaked down the drainage tube from his chest. Harper moved instantly. Pressure's dropping, she said. He's re-bleeding into the pericardium. She checked the monitor once. That was all she needed. He needs surgery now. Dr. Caldwell stepped directly into her path. No, he snapped. The entire room stared at him. Caldwell pointed furiously toward the doors. You are not touching this patient again. Move, Harper said calmly. I am still the attending physician in this hospital. And he's dying. You think battlefield improvisation makes you a cardiothoracic surgeon? Harper's jaw tightened slightly, but her voice stayed level. No, 20 years of trauma medicine does. That hit Caldwell like a slap, because for the first time all night, he realized she wasn't bluffing, and he hated her for it. Not because she embarrassed him, because she exposed him. Every person in that room had watched Harper diagnose a condition he missed, watched her save a man he nearly killed, watched military operators look at her with more trust than they gave him. The great Dr. Charlie Caldwell suddenly felt small, and arrogant men became dangerous when cornered. No operating room, Caldwell barked. Not under my authority. Lieutenant Miller took one step forward. You really want to do this right now, Doc? Caldwell ignored him. He pointed toward hospital security instead. If anyone assists this woman in practicing medicine without privileges, you'll all be named in the lawsuit. That landed. Several younger residents hesitated immediately. A nurse near the medication cart looked terrified. Even Brenda froze. Because civilian hospitals ran on fear of liability. Paperwork. The committees. Hierarchy? Not instinct. Not battlefield judgment. Harper looked around the room. She saw it instantly. The uncertainty. The hesitation. The fear. And for one brief moment, something painful crossed her face. Because she knew this feeling, not from hospitals. From combat. The moment right before people stopped acting because they were afraid to be wrong. Meanwhile, Donovan's monitor kept screaming. His fingertips were turning blue again. Harper moved to the bedside and placed 2 fingers against his neck. Weak pulse, weakening fast. "He's tamponading again," she said quietly. Nobody moved. The silence became unbearable. Then Commander Donovan grabbed Harper's wrist weakly. His hand trembled violently from blood loss, but his grip was still surprisingly strong. Harper. First name now. Not Captain, not Doctor. Just Harper. Like this had all happened before somewhere else. His breathing turned shallow. "You remember Kunar?" The room watched Harper carefully. She didn't answer, but her eyes did. And suddenly she wasn't in San Diego anymore. She was somewhere hot, dusty, burning. A medic screaming for plasma. Helicopters overhead. Incoming mortar fire. A collapsing surgical tent. Blood everywhere. And a younger version of herself trying desperately to save her husband. Harper blinked hard. The memory vanished. But not before Brenda saw tears briefly gather in the corners of her eyes. First time all night. Gone almost immediately. Donovan squeezed her wrist again. "You said," he struggled for breath, "nobody gets left behind." Harper swallowed once. "Hard," Caldwell scoffed loudly from behind them. "Oh, for God's sake, this isn't some Hollywood war movie." Lieutenant Miller turned toward him with open disgust. "You know what your problem is, Doc? I don't particularly care. You think confidence and competence are the same thing." The trauma bay went silent again. Miller pointed toward Harper. "She's the real thing, you're just loud." Caldwell's face flushed dark red. You military people walk in here waving guns and rank like it means something in medicine." "You missed the diagnosis," Brenda said suddenly. Everybody looked at her, including Harper. Brenda looked terrified she'd spoken, but she kept going anyway. "You missed it," she repeated softly. "She didn't." Caldwell stared at her in disbelief. Then Chloe stepped beside Brenda, and she saved him. Now the residents were looking uncomfortable too, because they all knew it was true. The room was turning. Fast. Caldwell realized it, and panic began leaking through the cracks in his arrogance. "You're all out of your minds," he snapped. "This woman assaulted me." Harper finally turned toward him fully. "You were about to put chest tubes into a man whose heart was being crushed inside his own chest cavity." "That's enough." "No," Harper said quietly. The word stopped him cold, because her tone had changed. Still calm, but colder now, sharper, the voice of someone used to command. "You stopped listening the second somebody challenged your ego," Harper continued. "And someday that's going to kill somebody who doesn't get a second chance." Caldwell looked genuinely stunned. Nobody talked to him like this. Not nurses, not residents, not administrators, and certainly not quiet women who spent 3 weeks silently taking abuse. But Harper wasn't shrinking anymore. She was unfolding, and it terrified him. Another alarm sounded. Donovan's pressure dropped again. 60/38. A nurse cursed under her breath. Harper immediately leaned over the patient, checking the drainage line. More blood. Too much. Not enough time. She looked toward the OR hallway, then back at the room. "Decision made. If we don't open his chest in the next 5 minutes," she said calmly, "he dies." Caldwell crossed his arms. "You are not stepping into my operating room." Harper stared at him for a long moment. Then slowly, very slowly, she reached up and removed her hospital badge, the cheap plastic card labeled Harper Quinn, RN. She placed it quietly on the blood-streaked counter between them. "I wasn't asking permission." The entire room went dead silent. Outside, thunder rolled over San Diego Bay. Inside the trauma center, every single person realized the same thing at once. Harper Quinn was about to risk everything she had left. The trauma bay exploded into motion. Not chaos, purpose. Harper turned toward the doors. "Or one now." The command cracked through the room like live electricity. And to everyone's shock, people obeyed. Brenda grabbed the portable monitor. Chloe slammed blood bags into a rapid infuser. 2 residents rushed to unlock the gurney brakes. Even the military police stepped aside automatically as Harper moved past them. Only Dr. Caldwell stood still, furious, humiliated, powerless. "You are all making the biggest mistake of your careers," he shouted after them. Nobody stopped. The wheels of Donovan's stretcher rattled violently across the hospital floor as they rushed towards surgery. Rain hammered the skylights overhead. Red emergency lights reflected off wet tile. A ventilator hissed beside the bed. Commander Donovan drifted in and out of consciousness while Harper jogged alongside him, one hand steady on the drainage line near his heart. "Stay with me, Donovan." His eyelids fluttered weakly. "You still bossy as hell." Harper almost smiled. Almost. Then his heart rhythm skipped again. The monitor shrieked. Brenda's face went pale. "He's crashing." "I know." Harper's voice never changed. That terrified Brenda more than panic would have, because Harper sounded like someone who had stood this close to death too many times before. The operating room doors burst open. Cold air hit them instantly. Bright surgical lights flooded the room in hard white beams. Inside or one, everything changed. The quiet nurse vanished completely. What replaced her was something else, something sharper, faster, more dangerous. "Transfer him now." Her voice carried absolute authority. No hesitation, no uncertainty. The staff moved instantly. "You bypass machine status." "Primed and ready." "Blood." 6 units O negative in room. "Cardiac tray." "Open." "Good." Harper scrubbed at the sink with brutal efficiency. Water splashed against stainless steel. For a brief second, Brenda stood frozen nearby watching her, because Harper's sleeves were rolled up now, and the scars were impossible to ignore. Jagged burn marks wrapped around her left forearm. Small white puckered circles peppered her shoulder. Shrapnel scars. Combat wounds, not hidden anymore. Harper caught Brenda staring. Neither woman spoke, but Harper gave the faintest nod, like she was finally too tired to keep pretending. Then she stepped into the OR, and the atmosphere shifted instantly. Every person in that room felt it. This was her territory, not Caldwell's, not the hospital's. Hers. Commander Donovan's blood pressure dropped again. 50/30. The anesthesiologist looked up sharply. "We're losing him." Harper stepped beside the table. For one brief moment, everything became quiet. The monitor beeps faded into the background. The storm outside disappeared. The entire room narrowed down to one wounded man and the failing rhythm inside his chest. Harper looked at Donovan's face, and suddenly another face flashed through her memory. Cheb, her husband, dust-covered fatigues. Blood on his neck, a medic screaming for clamps, her own hands shaking for the first and only time in her life. She blinked hard. Gone. Back to the present. Back to this patient. Back to this fight. Scalpel. The instrument hit her palm, and something inside Harper Quinn locked back into place. The incision was immediate, precise. Confident, steel glided through skin under bright surgical light. The room moved with her now like a machine. Suction. Retractor. More light. Blood pooled rapidly across the surgical drapes. The smell of cauterized tissue filled the air. One resident quietly gagged behind his mask. Harper never looked up. "Focus," she said calmly. The resident straightened instantly. Brenda watched Harper's hands move. No wasted motion. No ego. No dramatic speeches. Just terrifying competence. Then Harper reached the damaged pericardial sac surrounding Donovan's heart, and the entire room saw the problem clearly for the first time. A jagged shard of metal sat buried near the right ventricle. Each heartbeat forced fresh blood into the space around the heart. Slow suffocation from the inside. Caldwell would never have found it in time. Harper leaned closer. Clamp. The room was so quiet now they could hear the soft metallic tap of instruments against the tray. Even the monitor seemed quieter. Everyone understood the stakes. One mistake here, and the commander died instantly. Harper stabilized the damaged tissue with astonishing speed. Her eyes never left the wound, but her voice remained calm enough to teach. "You see the bruising here?" she said quietly to the residents. Blast wave trauma, the shrapnel wasn't the only injury. The residents nodded silently, mesmerized, because this wasn't just surgery anymore. This was experience carved from survival. Then suddenly, the heart monitor screamed. A long, violent tone. The rhythm dissolved into chaos. "V-fib!" the anesthesiologist shouted. Commander Donovan's heart began quivering uselessly inside his chest. The room erupted. Charging paddles. 300 joules. Brenda's hands shook, reaching for the defibrillator. But Harper stayed terrifyingly still. Everybody clear. The shock hit Donovan's body hard. His muscles jerked violently against the restraints. The monitor flatlined. One long, continuous tone filled the room. Nobody breathed. Not even Harper. For one awful second, it looked over. Then, beep. A tiny spike appeared on the screen. Beep. Another. Then suddenly, a full rhythm returned. Strong, steady, alive. The entire operating room exhaled at once. One nurse actually started crying behind her mask. Harper didn't celebrate, didn't smile. She just kept working. Closing, repairing, saving him. 'Cause somewhere deep down, this wasn't victory to her. It was duty. And as the storm continued raging outside San Diego Memorial Hospital, the staff inside OR1 finally understood something terrifying. Dr. Harper Quinn had never stopped being a surgeon. She had only been hiding from becoming one again. 3 hours later, the storm had finally started to weaken outside. Rainwater crawled slowly down the tall ER windows. The hospital corridors smelled like burnt coffee, antiseptic, exhaustion, and adrenaline after the crash. Inside OR1, the surgical lights dimmed one by one. Dr. Harper Quinn peeled off her gloves slowly. Blood streaked the front of her gown. Tiny droplets spotted her forearms and scars alike. Commander Donovan was alive, stable, breathing on his own. And for the first time all night, the room allowed itself to breathe too. One of the younger residents leaned against the wall, looking shell-shocked. "I've never seen surgery like that before," he whispered. Harper barely reacted. "Because nobody should ever have to do surgery like that," she answered quietly. The room fell silent again. That line stayed with Brenda forever, because there was no pride in Harper's voice, only memory. Harper stepped away from the operating table while nurses transferred Donovan toward recovery. Lieutenant Miller was waiting outside the OR doors the second they opened. The massive SEAL looked ready to collapse from exhaustion. But when he saw Harper, relief flooded across his face. "He's stable," Harper said. Miller closed his eyes briefly. A shaky breath escaped him. Thank God. For a second, the hardened operator looked young again. Just another scared man who almost lost someone he loved. Harper handed him the surgical report clipboard. Small ventricular tear, significant blast trauma. He'll need monitoring for a while. Miller nodded silently. Then after a pause, "You saved him again." Harper looked away immediately. Like the words physically hurt. "That's my job." "No," Miller said softly. "That's who you are." She didn't answer. Down the hallway, voices suddenly erupted near the nurses' station. Angry voices. Security voices. Caldwell. Even exhausted, everybody recognized that voice instantly. "This is absurd," Caldwell shouted. "You cannot suspend me over one disagreement." Harper closed her eyes briefly. Of course he was still fighting. Men like Charlie Caldwell never believed consequences applied to them. The hallway outside the ER had become crowded now. Residents, nurses, administrators, even paramedics lingered nearby pretending not to watch. And in the center of all of it stood Dr. Charlie Caldwell, looking smaller than anyone had ever seen him. His custom scrub top was wrinkled. Blood stained one sleeve. Sweat clung to his temples. Across from him stood Hospital Administrator Harrison, alongside 2 members of Hospital Legal Counsel. "Hey, Charlie," Harrison said carefully. "This is no longer negotiable. You're destroying this hospital because of one psychotic nurse with a military sob story." Several nurses nearby visibly flinched, but Harper kept walking calmly toward the group. The crowd parted instantly for her. Caldwell saw her approaching and pointed furiously. "There she is. She assaulted me, violated protocol, hijacked my operating room, and saved your patient," Harrison interrupted. That shut him up for half a second. Then Caldwell laughed bitterly. "You people actually think she's some kind of hero?" Nobody answered, because after tonight, most of them did. Caldwell looked around desperately, at the residents who once worshipped him, at the nurses he'd bullied for years. at the security staff refusing to meet his eyes. His kingdom was gone, and deep down, he knew it. "You're making a mistake," he muttered. "No," Brenda said quietly from the back of the crowd. Everybody turned toward her. The veteran nurse swallowed hard, then stepped forward. "For years we kept telling ourselves your behavior was worth tolerating because you were brilliant," she said. "But tonight we realized something." Caldwell stared at her. Brenda's voice shook slightly. "You stopped listening." The words hit harder than yelling ever could. Because they were true." Harper stood silently near the wall while the confrontation unfolded around her. She didn't look triumphant, didn't look vindicated. Mostly, she looked tired. The kind of tired sleep doesn't fix. Harrison finally handed Caldwell an envelope. "A pending full review by the medical board," he said. "Your surgical privileges are suspended effective immediately." Caldwell stared at the paper in disbelief, then at Harper. Hatred flickered across his face, but beneath it, fear. Because for the first time in his career, he had been exposed in front of everyone. Not by another surgeon, not by administration, by the quiet nurse he mocked for 3 straight weeks. Caldwell opened his mouth one last time, but no words came out. He turned instead, and walked away down the corridor alone. No one followed him. No one defended him. The sound of his expensive shoes faded slowly against the tile floor until finally, silence. A strange silence. A peaceful one. Brenda looked around the ER in disbelief. The tension that had ruled the department for years was just gone, like a storm finally breaking. Then Chloe suddenly smiled at Harper. A real smile. "So," she said carefully, "you were just gonna let us think you were some terrified new nurse forever?" For the first time all night, Harper actually laughed. Soft, brief, human. "I was trying very hard to be forgettable," she admitted. "That may be the least successful mission in military history," Miller muttered. Even Harper smiled at that one. Then the recovery room doors opened quietly. A young Navy corpsman stepped out. "Commander Donovan's awake," he said. Miller immediately moved, but paused when Harper didn't follow. "You coming?" Harper hesitated, just for a second. Then she shook her head. "He doesn't need a surgeon right now," she said softly. "He needs his team." Miller studied her carefully, understanding something the others didn't. Harper Quinn still carried survivor's guilt like body armor. Saving lives was easier for her than living her own. Before he walked away, Miller stopped beside her one last time. "You know," he said quietly, "those guys in there," he nodded toward recovery. "They never forgot what you did for them over there." Harper's eyes lowered. Miller's voice softened. "And neither should you." Then he disappeared into recovery, leaving Harper standing alone in the quiet hallway. Rain tapped softly against the windows now, gentler, far away. Brenda walked up beside her. "You okay?" Harper stared through the glass for a long moment before answering. "I don't know yet." And somehow, that honest answer meant more than any dramatic speech ever could. 2 weeks later, San Diego Memorial Hospital felt like a completely different place. The yelling was gone. The fear was gone. No more residents flinching when footsteps approached the trauma bay. No more nurses silently warning each other about Dr. Caldwell's mood before shift change. For the first time in years, people could breathe there. The night shift moved with calm confidence now. Music played quietly at the nurses' station sometimes. People laughed again. And strangely enough, most of that change traced back to the quiet woman who never wanted attention in the first place. Dr. Harper Quinn walked through the ER just before sunset, coffee in hand, reviewing trauma reports on a tablet. She wore dark navy attending scrubs now. The embroidery over her chest finally matched the truth. Harper Quinn, MD, FACS. But despite the title, very little about her had changed. She still spoke softly, still skipped hospital politics, still drank terrible black coffee at 2 a.m., and she still occasionally disappeared onto the rooftop parking structure alone during storms. Only now, people understood why. A fresh trauma alert echoed overhead. A motor vehicle collision, ETA 4 minutes. The department shifted instantly into motion. But unlike before, nobody looked afraid. Harper glanced up from the tablet. "You Brenda, take airway." "Got it." Chloe, prep trauma 2. Already moving? Harper nodded once. No screaming, no humiliation, no ego, just trust. That was the difference. As the team scattered, one of the younger nurses approached Harper carefully. Dr. Quinn. Harper looked up. The nurse hesitated. I just wanted to say, she swallowed nervously. You changed this place. Harper's expression softened slightly. No, she said quietly. People here changed it themselves. They just stopped being afraid. The nurse smiled. But before she could answer, a familiar voice echoed from down the hallway. Still giving motivational speeches instead of sleeping, huh? Harper turned. Commander Albert Donovan stood near the elevators wearing jeans, a hoodie, and a healing scar visible above the collar of his shirt. Lieutenant Miller stood beside him holding a hospital visitor badge and looking deeply amused. Brenda nearly dropped a chart. You're walking already? She asked. Doctors hate me, Donovan replied dryly. Apparently, surviving explosions makes patients difficult. Harper crossed her arms. You skipped 2 follow-up appointments. Donovan pointed immediately. See, told you she's terrifying. Even Harper smiled at that one. A real smile this time. Not forced, not guarded. Human. Donovan stepped closer slowly. He still moved carefully from the surgery. But he was alive. That mattered. For a moment, neither of them spoke. Years of history sat silently between them. Finally, Donovan looked around the trauma bay. You stayed. Harper followed his gaze. Nurses moving quickly between rooms. Residents working calmly. Patients being treated. Life continuing. Yeah, she admitted softly. Donovan nodded slowly. Good. He understood what that meant. Because staying was harder than leaving sometimes, especially for people carrying ghosts. Miller leaned casually against the counter nearby. You know the guys have a nickname for you now. Harper immediately looked suspicious. I don't want to know. Oh, you really do? Lieutenant? The Angel of Kunar. Brenda's eyes widened instantly. Harper closed her eyes in pure exhaustion. Absolutely not. Miller grinned. Too late. It stuck years ago. Harper muttered something under her breath that definitely wasn't appropriate for a hospital. That made Brenda laugh so hard she had to walk away. But Donovan's smile slowly faded. His expression turned serious again. You saved a lot more than my life that night, Harper. She looked at him carefully. Donovan glanced around the trauma center. At some point, people here forgot medicine's supposed to be about patients, he said quietly. You reminded them. Harper looked away for a second, because praise still made her uncomfortable. Probably always would. A trauma alert sounded again overhead. Level 1 incoming, multiple internal injuries. The ER immediately accelerated around them. Harper's instincts switched on instantly. Focused, sharp, ready? Donovan noticed and smiled faintly. There she is. Harper grabbed a pair of gloves from the counter, then paused. For years, she'd tried to bury this part of herself, tried to disappear into the background, tried to become small enough that the past couldn't find her anymore. But pain didn't disappear just because you ran from it. And sometimes, the things that break us are also the things that show us who we really are. Harper looked back at Donovan one last time. You gonna be okay? The SEAL commander smirked. It depends. You planning on tackling any more surgeons? Only the stupid ones. Miller burst out laughing. Then the ambulance bay doors slammed open. Paramedics rolled in a teenage girl covered in blood. Her mother ran beside the stretcher, sobbing uncontrollably. Everything changed instantly. Fear, noise, chaos, life and death colliding again. Harper moved toward the incoming trauma team without hesitation. The young girl's hand twitched once against the stretcher rail. Tiny movement, easy to miss, but Harper saw it immediately. Always the small details. Always listening. He hang 2 units blood, Harper ordered calmly. And somebody get me ultrasound now. The entire trauma team moved as one behind her. Not because they feared her, because they trusted her. And as the doors closed behind the rushing stretcher, Commander Donovan watched quietly from the hallway. A faint smile crossed his face, because the woman who once tried so desperately to disappear had finally stopped hiding. Maybe that's the thing about hidden heroes. They rarely announce themselves. They don't walk into rooms demanding respect. Sometimes they're just the quiet person in the corner, the one everybody overlooks, until the moment everything falls apart, and suddenly they become the only person strong enough to hold the line. If this story moved you, let us know in the comments. And if you believe no one should be left behind, whether on the battlefield, in a hospital, or anywhere else in life, subscribe and join our community for more stories about the hidden heroes walking among us every day.